where we are and where we've been, frankly, as it relates to the issue of mental health, substance abuse disorder, and homelessness broadly in the state of California. I continue to remind people, because it's important to be reminded of a bipartisan endeavor that really started to take shape in the late 1950s, was accelerated in the 1960s and 70s, and in many respects nationalized in the 1980s. And that was a move away from psychiatric beds. In 1957, in the state of California, with a population of half the population that we enjoy today, the state of California had 37,000 psychiatric beds. Fast forward to 1967, down to 22,000. We announced a number of years ago when we launched the campaign for Proposition 1, the $6.38 billion bond, that the community vision was never realized. So much so that we went from 37,000 at peak in 1957 down to about 5,500 psychiatric beds about the time we launched in March of 2024, at least Election Day of March of 2024. We celebrated the success of Proposition 1, the commitment now to rebuild, to address the decade-long gap in terms of fulfilling the promise for community-based alternatives to those psychiatric beds. We launched that not only formally with the Capital campaign, because we recognized the imperative for more beds, that for all the other work we were doing, and we'll highlight some of it at the end of my presentation, around behavioral health and sort of knitting the fabric back together, that we still had fundamentally not addressed the issue of beds, the critical issue of beds. And that's why it was important, critical, that we advance that $6.38 billion bond. And so today we are updating and announcing where we are with the second round commitment for this bond. I'll remind everybody, this is the fastest distribution of funds for a state bond in history. We highlighted that last year when we announced the first $3.3 billion in the bond. This is the second round of that bond, $1.18 billion, that will award 66 projects, 130 facilities that are part of that overall goal on residential treatment beds and outpatient treatment beds. And I'll remind you that goal was a numeric. The goal that we promoted in Prop 1 was 6,800 residential treatment beds and 26,700 outpatient treatment slots. I'll give you the total in a moment, but this round provides for 2,554 residential treatment beds, 4,273 outpatient treatment slots. You can see these projects are stretched all throughout California, and you'll notice with the dots of those 66 projects and the 130 facilities, so many are in parts of the state that frankly have been significantly under-resourced in the past. This was another commitment we made. Not only were we going to get the funds out, we'll get to accountability and transparency in a moment, but we were going to make sure the funds were distributed to parts of the state, first-time awardees and rural parts of the state that had frankly been forgotten and left behind as it relates to the issue and the crisis of mental health, behavioral health, and substance abuse in the state. You look at both rounds, round 1 and 2, the combined now distribution with today's announcement of $4.17 billion under Proposition 1. It's a total of 177 projects. You can see the number of facilities, 333. And now we've now exceeded the commitment that we promoted and promised in Prop 1. Again, it was 6,800 residential treatment beds. With this announcement, 119 more beds than promised, just with this second round, and 861 more outpatient treatment slots. So this is a point that needs to be emphasized. Exceeding the goal in record time with the distribution of funds to parts of the state that have been underserved, rural and first-time awardees, to address this historic mistake that we've made, not only in the state of California, but across the country, as it relates to fulfilling that commitment and promise for community-based alternatives. I want to remind folks this is not the only investments we've made in what we call this Bsky.app program, and that's just a fancy way of saying our infrastructure grant programs for behavioral health. And we started this even before we asked the voters for that $6.38 billion, Prop 1 in March of 2024. I started in about 2021 working with the legislature to make a case anew that we needed more capital investments. And so the additional $1.6 billion came from the general fund, investments that are paying off. So here's the totality. You can see now 437 projects. When you add the budget money with Prop 1 money, close to $6 billion that we committed to for this unprecedented investment into residential treatment beds and outpatient treatment slots. The number of facilities that are now open and operational, some close to 4,000 outpatient treatment slots are now locked in and done. We're serving close to 1 million people now annually at 36 facilities that are open. And these were open, many of these, with the fast track approval, part of the reform agenda that was part of Prop 1 was CEQA reform, land use reform, very familiar for some of you that are familiar with our Home Key program, which was wildly successful, that came out of the ashes of COVID and this sense of urgency, this emergency mindset. We put that into the reforms we advanced with Proposition 1. Some of that has been impacted by, candidly, tariffs, supply chain issues, so there's been some slippage in some of the projects. We're deeply mindful, aware of that, but we're just managing that on a daily basis. And as well, we're also counting down the days to July 1st of this year, because another component part of Proposition 1 was the reform of our Mental Health Services Act, and that was this transfer of roughly 30% of the annual appropriations, $1 billion a year, to focus on housing. And that goes into effect July 1st of this year. And that will be the ongoing money that the cities and counties say they need to make long-term commitments. You've got the capital infusion, and now you've got, through the Mental Health Services Act money, this redirected investment, integrating housing, integrating mental health, integrating substance abuse disorder. This is what we've been asking for decades in the state, and now we're delivering it. And that delivery date is July 1st, and that is significant in terms of the ongoing commitment beyond just the capital infusion under this program. I mentioned it's $6.38 billion. We referenced the money on the capital program. There are two components, and just to remind folks, the second component of the money is through the traditional Home Key model. Again, wildly successful program of supportive housing where we're buying hotels and motels, quickly converting and rehabbing facilities, again, in record time at record low cost compared to traditional means to which the state and often counties and cities procure new properties and rehab them, lowering the cost, quote unquote, per key. We've already distributed $797 million, so you'll see that there's $2.25 billion that needs to be awarded. We still have more investment to make in Home Key. We'll be announcing those very shortly. But $797 million has been awarded, already serving close to 21,000 people, building on the successful Home Key model. Again, they came out of COVID, originally Room Key, and then it was Home Key. We now call this Home Key Plus. This is complicated, and again, it's not. It's well-designed, well-considered, multifaceted. And that was this Home Key was the second commitment that we made to the voters, all part of this broader behavioral health transformation. And you can see all of the programs. And, this is just, we've never done anything like this at scale. There's simply no jurisdiction in the United States that is investing these kinds of resources across the spectrum to address the issue of homelessness, housing, mental health, and substance abuse. And you have heard me go on and on about CalAIM and the fundamental reforms we've made in the Medicaid system, our Medi-Cal here in the state of California, that are just without precedent. BH Connect, which is nothing, for me was one of the great achievements near the end of the Biden administration, getting the support of the Biden administration quite literally just a few months before they left, that provides the workforce. BH Connect is a critical component of our goal of 65,000 new participants in terms of our workforce development and training over a 5-year period. BH Connect is foundational in terms of that workforce investment, and that provided under that waiver ability to draw down federal money in that effort. You know what we're doing because we keep talking about it. It needs to be talked about more. What are we doing for our kids, Bright Life kids, Soluna for our kids, the work we've done to bring wellness centers back into our public schools, not just for physical health, but again for adolescent mental health. You see the myriad of programs, the mobile crisis streams and the eligibility for those mobile crisis units to go out on the streets, and the eligibility now under Medi-Cal, all again part of this fundamental transformation of behavioral health in the state of California. Again, a critical part of our overall efforts, again, to address the crisis of homelessness, but also knit back and address this growing crisis that was exposed at scale, particularly during COVID. And that's addressing the issue of our behavioral health and mental health across the spectrum. All that is inured, and you know, first time we can lay claim to this in over a decade and a half, that 9% reduction in unsheltered, and that's the new key numeric, is the unsheltered homeless rate. And I'll just compare it just last year. We're waiting for the national numbers. It's been months. But last year, we basically were flat, 0.45% on unsheltered. You saw just huge spikes. Illinois, you can see that number. This is not a cheap shot. It's not an indictment. You saw it across the country. In red states, blue states, you're starting to see spike in unsheltered homelessness all across the states of America, from Florida to New York, Texas, et cetera. And meanwhile, we're running contra to that data. We're starting to bend that curve. Last year was basically flat, less than 0.5%. This year down again, close to 10%. And we're waiting, we're waiting just to see where we are vis-a-vis all of these other states. We also have a state of mind, and I'll close and turn it over to Director Moss, but really focused on encampments. And you saw just, I think it was 10 days or so ago, we were in the East Bay talking about our efforts around Prop 1, but also our ongoing efforts to prioritize, through accountability, real results as it relates to addressing the issue of encampments in particular. Over almost 21,000 encampments have been cleared over the last 5 years as a priority in terms of our partnerships with cities and counties and our MOUs, basically our contracts with the cities and counties, and just direct efforts through state operations to focus on the critical issue of cleaning our streets and sidewalks. Safety, stability, a sense of security, that's foundational in terms of the work that we expect and want to see done. And again, we have to drive that at the local level. It's not an abdication, quite the contrary. I made the point about this unprecedented support that the state is providing for cities and counties, unprecedented in U.S. history, not just California history. But now we drive speed to delivery. People are sick and tired of the rhetoric. They want to see things built, and they want people off the streets and people in crisis having opportunities and options in real time. They're sick and tired of the old binary, which was jail or encampments, and they want new pathways and new strategies, a support and care first model versus a fail first model. That's all, again, part of this transformation. And that transformation is highlighted through new accountability measures that are highlighted by county on our accountability website, accountability.CA.Gov. And I cannot encourage folks more the importance of holding all of us at every level of government to a higher level of expectation and accountability. And we are highlighting those cities and counties that are succeeding across the spectrum, meaning delivering on what we're promoting here at the state level, and those that are falling behind. And I continue to make the point, we are not interested in funding failure anymore. The state, again, has simply done too much, and now it's time to deliver at the local level. And we want to fund successful programs. We want to reward initiative. We want to award creativity. And we continue to be iterative to the extent we need to, I've followed up with some of those counties that we called out under Care Court. A number of the mayors and county leaders reached out, and they have specific things they would like us to fix at the state level, and we are working actively and proactively engaged in those reforms, and we'll continue to work with the legislature on that. Again, it's all about iteration, but it is fundamentally about accountability and transparency. And so I want to end on that slide and just thank the team for their outstanding work. A number of them you're going to hear today. They put a strike team together, put a task force together. They were tasked to do something in real time. They were tasked to address the anxiety that voters are feeling, taxpayers are feeling. Again, it's about liberalism that builds. It's about addressing time to delivery. There's certain things we can't control as it relates to macroeconomics and, again, these tariff policies and supply chains that have made it more challenging, not an excuse. We still have to work around that, and this is the team that's doing it. Madam Director, Michelle, I pass it on to you to talk more about how you are battling it in real time and holding us all to a higher level of accountability.
Thank you, Governor. Good morning. I'm Michelle Baass, Director of the California Department of Healthcare Services. Today marks an important milestone for California's behavioral health system. Thank you to our DHCS team, grantees, counties, tribal partners, and providers. Your partnership and dedication made this possible. 2 years ago, Governor Newsom and California voters committed to an unprecedented investment in behavioral health infrastructure. Today, with the announcement of the second and final round of Bsky.app awards, we are fulfilling that commitment. With today's awards, California surpasses Proposition 1 goals for expanding treatment beds and outpatient capacity. Bsky.app rounds 1 and 2 awards will deliver 6,919 beds and 27,561 outpatient slots, exceeding the capacity goals outlined in Proposition 1. From Siskiyou to San Diego, these investments reach communities in every region of the state, from rural areas with no facilities to large counties with long-standing gaps in crisis and residential care. These Bsky.app awards build upon earlier Bsky.app funding rounds. Since 2021, we have invested over $5 billion in behavioral health infrastructure across California, creating over 9,500 new beds and over 47,000 new outpatient slots. Once fully operational, these expanded services will serve more than 5 million Californians each year, including many Medi-Cal members who rely on these services. Behind every one of these numbers is a real person who deserves timely, culturally responsive care. Too many children, especially in rural counties, must travel long distances for specialty mental health services. Individuals with substance use disorders may face long wait lists or lack of nearby treatment options. Many communities, including tribal and rural areas, have never had a behavioral health facility of their own. Today's awards are changing that reality. We are expanding residential treatment beds and outpatient care in communities that need them the most. We are integrating mental health and substance use disorder treatments so people can access comprehensive care in one place. We are doing all of this with a focus on Medi-Cal members, cultural responsiveness, and language access. Over the next 30 years, these facilities will meaningfully improve the lives of millions of Californians. By expanding care close to home, in people's communities, we can reduce unnecessary hospitalizations and incarceration. We are also investing in innovative models California has never funded before, including tribal peer respite, father with children treatment programs, expanded perinatal residential care, youth peer respite, and campus-based crisis and residential facilities. These projects improve health outcomes, create local jobs, and strengthen communities. I am tremendously proud and grateful to the DHCS team, led by Marlise Perez, our grantees, and our state for bringing this vision to life. California is demonstrating national leadership in expanding community-based behavioral health care for Medi-Cal members and all Californians. Again, thank you for your partnership and your commitment to delivering care, dignity, and opportunity across our state. I will now turn it over to Doug Bond, President and CEO of Amity Foundation.
Thank you, Director Baass, and thank you for your leadership. My name is Doug Bond, and I'm the President and CEO of Amity Foundation. Amity is proud and excited to be partnering with the Governor, California Health and Human Services, and the Department of Healthcare Services on Prop 1 to support the Bridge to Ontario campus, serving Californians in the Inland Empire. It has been our mission since we were founded in the 1980s to uplift those marginalized by addiction, trauma, incarceration, poverty, homelessness, and violence. This campus will not only be a bridge to changing lives, but will be a model for smart public health and public safety. here in California and to the rest of the United States. So many of us are all too familiar with the harm substance use disorder can introduce into our lives and our community, whether by our own actions or the choices of our loved ones have made. Roughly 1 in 5 Americans will experience substance use disorder in their lifetime. That statistic is staggering, but it ties the issue directly to my community, your community. It's not those people suffering, it's us. Your neighbor, your coworker, your mother or father has been through this. Perhaps you've been through this as well. There was a time in my life when I was in the foster system when my parents struggled with substance use disorder, and I also struggled with substance use disorder as a young adult. But I'm proud to say I was able to overcome those challenges because I had access to services and support systems like this one. I'm here today not only helping others, but also as a proud father and husband because of that investment. Thank you to Governor Newsom and Prop 1. We finally have the resources to rebuild what was neglected for too long. This administration's investing in hope, and we can see a light now at the end of the tunnel. For too long, our communities have seen substance use disorder, homelessness, and the revolving jailhouse and prison doors eat away at the fabric of our society. It's no secret that hopelessness has taken hold. This is how we fight back. These programs not only provide a pathway for treatment, but reduce crime and recidivism in our community, which creates safer and healthier communities for all of us. This campus and the larger Prop 1 initiative will be the foundation for our communities to address homelessness, improve workforce development opportunities, and heal families. And when our children can watch their parents, aunts, uncles, and their grandparents finally get the help that they need, break the harmful cycle of addiction, we're giving the next generation the power to make different choices in their own lives. The ripple effect of this investment will be felt across generations for Californians and will be the model for the United States. I know what it means to find our way out, and I know that we can't do this alone. That's what we're rebuilding here. Not just a facility with 100 beds with a host of services, but a community that is safer, healthier, and believes people deserve a second chance at making things right. Thank you, Governor Newsom, for your leadership on public health and public safety, and we couldn't be more excited to open our doors and start caring for the people in this region. Next, I would like to introduce Genevieve Valentin, San Joaquin County Health Care Services Director.
Thank you, Doug. I'm Genevieve Valentine, San Joaquin County's Healthcare Services Director, and it is an honor to be here today. I want to express my deep appreciation to the Governor, the Governor's Office, DHCS Director Baass, Secretary Johnson, Chief Perez, and our partners at AHP. Your unwavering support and advocacy for behavioral health is shaping a stronger and more responsive system of care for all Californians. Thanks to your leadership, we are advancing one of the most transformative, integrated behavioral health initiative in our region's history, the SJB campus. This campus represents a bold, comprehensive vision of what behavioral health can and should be: accessible, coordinated, compassionate, holistic, and built with the whole continuum in mind. We know that untreated mental health and substance abuse disorders are driving our region's homelessness. Too many of our neighbors are cycling from streets to emergency rooms to jails, not because they choose to or want to, but because our system lacks the capacity and coordination to intervene early and often. But our SJB campus, we are directly responding to that reality. Be Well Phase 1 was made possible by combining our $157.5 million Round 1 B-TRIP award, our local opiate settlement funds, and county investments to bring online in 2027 140 more beds and an extraordinary array of services across our entire continuum. What truly sets our campus apart? It is our county's commitment to integrated care. Our county is dedicated to providing streamlined, collaborative, coordinated, integrated care and community education. So what I'd like to do first is thank our county CAO, our board of supervisors, our health plan of San Joaquin, our governor's office, our surrounding county partners, specifically Stanislaus and Merced County, and 3 very specific agency partners: our Office of Education, our county's operated FQHC, fondly known as SJ Health, and our county's public health department. These 3 departments, in alignment with behavioral health, has partnered to make a one-stop shop co-located campus. Now, thanks to our new $38 million Round 1 award, additional opiate settlement funds, and continued county investments, our SGB Well campus has the opportunity to deepen our treatment continuum. This award gives us the opportunity to build a 6-county regional 52-bed social rehabilitation center and community wellness program, where we're not only offering traditional behavioral health services, but life skills, vocational training, and hands-on employment opportunities. These additional services will expand treatment capacity and create a community-centered environment where recovery is supported every step of the way. For individuals experiencing health or behavioral health crises, this means you can walk through one of our doors and receive coordinated, person-centered care without navigating a fragmented system. This campus and our cross-county collaboration will change behavioral health in the Central Valley for generations. To the Governor's Office, DHCS, Cal HHS, AHP, and my Board of Supervisors, thank you. Thank you for believing in this vision, for championing behavioral health, and for standing with us as we build something worthy of the people we serve. Together, we are creating a future where care is integrated, recovery is possible, and every California has the opportunity to thrive. I am now honored to introduce Secretary Kim Johnson of the California Health and Human Service Agency. Thank you, and God bless the Central Valley.
Thank you so much, Director Valentine, and just appreciate your heartfelt remarks there. And as you've heard today marks a major milestone, not only for California's behavioral health transformation journey, but the journey and communities for all Californians with the creation of these spaces and places to heal. A foundational goal of this transformation is to build a continuum of care that serves Californians from prevention and early intervention to community-based services and crisis response, inpatient care, and supports for sustained recovery and wellness. Making sure that Californians can access the care when and where they need it is the definition of delivering care that is accessible and equitable for California's diverse people and geography. Today and tomorrow, Californians across the state have more access to mental health and substance use treatment options. The days of traveling hundreds of miles for needed care or not finding it at all are soon to be behind us. Whether it's services for children, youth, and families, or older adults, the collective impact of these investments supported by the voters just 2 years ago is historic. Together with the nearly a dozen additional behavioral health initiatives that you saw displayed, achieving transformation results in improved care experiences in the community, fewer negative outcomes from untreated illness, reducing hospitalization, homelessness, and incarceration, a better health and well-being, and a higher quality of life. Today is truly unique. California is delivering on its promise to build accessible treatment and services for those in need, while also implementing a statewide prevention strategy to reduce the likelihood of mental illness and substance use disorders from the start, including doubling down on investments to prevent suicide and overdose. Today, the California Department of Public Health has also published its Behavioral Health Services Act population-based prevention plan, outlining how we will implement a comprehensive prevention strategy. So tremendous gratitude to Director Baass and the team at the Department of Healthcare Services, Director Pond and the team at the Department of Public Health, Director Landsberg and the team at the Department of Healthcare and Access Information who's leading this critical workforce component. These leaders are delivering. And thank you to our local implementation partners like Director Valentine, CEO Bond, tribal communities, all who are committed to meeting the needs of Californians who need us the most. Finally, thank you to our legislative partners and, of course, to Governor Newsom, who have made unprecedented investments in this transformation. Governor, thank you for your insistence that we use every tool at our disposal, that we create new tools to address gaps, to ensure that 5.4 million Californians will have a higher quality of life as a result of these new spaces to heal and recover, and that all Californians have the help they need when and where they need it, integrating the health, human, and housing services that we've designed together. Governor, I'll turn it over to you for our questions and answers.
Thank you, Madam Secretary. And before, I just want to, let me populate, just want to show you guys a little bit of what we have in store and just some completion dates. To give you a sense, just I showed those dots, but I think it's a little more interesting. And for me, it's been a lot more interesting as I work with the staff on a consistent basis to see the schematics of what actually is being done. So here's a West Hills project that will be up and operational just next month. You see later this year in Napa, a project that is being designed. Beaumont in August of 2028 in Fresno, California. We've got additional projects in Bishop and in Santa Maria. And this gives you a sort of sense of what these projects look like. And again, this is where we need local government. This is where it's critical that they're taking advantage of the tools that the voters afforded them as it relates to land use and SEQA reforms and zoning reforms. It's critical, the partners that we have, not only local ground, but the private sector, building, construction, trade, and also we deliver on those critical lines. But it gives a sense of how we're going to be flooding the zone over the course of the next few years as these projects come online. But let me show you what's already online. Here in Los Angeles, there is a sobering center that is up and operational. Gives you a sense of the scope. Again, all of these are different, unique. Some are campus style. Some are simple these are sort of rooms with multiple patients. You'll see here in Santa Rosa. Again, some of these are not exotic. We're not trying to overdo it here. We're just trying to provide that critical support across the spectrum. This is around withdrawal management in particular in Santa Rosa and Lancaster. Here's a new treatment center, a residential treatment center for substance abuse disorder. So that's, again, all part of this round 1 and 2, $4.17 billion, exceeding the goal in record time in terms of our commitment. And now we've got a contract within 90 days, all of the second round proposals. They've got to have financing lined up, and the licenses need to be aligned with the state. And then we're off and now finally building that system that for decades and decades we've been talking about. So with that, we're happy to answer any questions. And again, we're grateful for all of the leaders that are assembled here today that made all this possible.
We'll now transition to the Q&A portion of the program. If you're a member of the media and you would like to ask a question, please click the raise hand icon at the bottom of your screen and then unmute yourself when called upon. Queue is filling up now, and the first person in our queue is Sophia Bolag with the San Francisco Chronicle. Sophia, please unmute yourself.
Hi, Governor. I have an on-topic question and an off-topic question. So first of all, you mentioned that you've had conversations with some of the mayors that you called out last week for low care court performance in their counties and cities. I wonder, what are the specific things those mayors asked you to fix related to care court? And I also wanted to ask, as a second question, ABC News reported today that the FBI has warned California police departments that Iran could launch drone attacks at the West Coast. Do you have any information about that, and what's your reaction to that news?
So as it relates to the back and forth with local officials and our secretary's here, and she's 24/7 working in this space to address those concerns. We'll make public what those are. Some is just some ambiguity, some clarification, bringing specialty teams down there to address some of those concerns that don't require any state action whatsoever. It's just interpretation and clarification. Some of them may require a little bit more flexibility working with the legislature. And so we'll sunshine all of that. We'll reveal all that over the course of the next few months. Each circumstance is unique and different. But the good news, I think what I'm really trying to communicate was how responsive people were and how committed people continue to be, regardless if they're on the ICU list, as we refer to it, the bottom 10 or in the top 10. I was very grateful for the spirit of that engagement, and it was direct, but obviously the secretary and her team are working overtime to make sure they address those concerns. As it relates to the broader concern, as it relates to drone strikes, we've been aware of that information. We've been working collaboratively through the SOC, which we established right after the war began, the State Operations Center, working with the Office of Emergency Service, but also working locally to make sure we transmit any information that we have received, and we're aware of that, which has been reported, I think, by ABC7. We're aware of that information, and we transfer that information in real time to our local partners. Drone issues have been always top of mind, and we've assembled some work groups specifically around those concerns. But that's all I'll share at the moment. I have nothing more insightful beyond just what's been reported and how we're transmitting what we know to our local partners, which is critical.
Our next question in the queue comes from Alex Michelson with CNN. Alex, please unmute yourself.
Hi, Governor. I will follow in Sophia's model and do one question on topic and one question off topic. The on topic question. You've talked so much about the abundance mindset and sort of the bureaucratic challenges of going against the status quo on some of these very issues. I'm curious what you're seeing as the biggest challenge bureaucratically and actually making this stuff a reality. And the off-topic question, congrats on the book. I really enjoyed it. And it's so personal and so full in a way very few politicians are. You've been traveling the country talking about these very deep issues with folks. And I'm curious how that experience of opening up in this space has maybe changed you as a man, and maybe the experience of talking about it maybe has changed you as a leader going in that space all around the country.
Well, I appreciate that, and let me answer that, give it justice. But let me first tackle your first question. Look, bottom line is, I think the mindset of the state of California is less now about accommodation. It's about results. People are demanding results in that mindset of abundance. It's not about process. It's not about processing people's feelings about process. It's about delivering results. And that's what we're doing here. We learned the lessons of the past as it relates to the lessons that really came out of COVID. And I think, boy, that's a segment that we can spend perhaps a great deal of time on. A lot of things were accelerated in terms of our mindset and expectations through COVID that now are permanent, not bugs, but feature as it relates to housing and reforms and homelessness, around land use, around our environmental rules and regulations and all those regulatory thickets as it relates to CEQA. Home Key was an example of that during COVID. And literally, Proposition 1, we modeled the language under Home Key, under the emergency authority that I had as governor, and we incorporated it into the bond and the ballot and asked the voters to codify that as it relates to behavioral health housing and substance abuse support across this state. And so it's the reason we can lay claim now to having exceeded our goals in terms of what we're now going to contract and how we can accelerate the delivery to those goals. So it's foundational. It's a liberalism that builds. The people deserve that. Our party needs to reconcile that. We've got to deliver. This is a big deal. This is an effort that has never been attempted at the state level. And in order to go back to the voters to ask for more support and more funding, we have to deliver real results. I hear that loudly and clearly. And to the extent that I also, feedback I got loud and clear as it relates to this book tour, it's been pretty extraordinary, particularly talking about single moms. And so first thing that I thought about when you asked that question was the reaction I've gotten, disproportionate, from single moms that come up to me after I talk about their own experiences with their mom or the moms themselves. And it's very emotional, particularly with mothers that show me their kids. They could be 40 or 50 years old. They could be 5 or 6 years old and literally tearing up. And it's just, it's a wonderful and cathartic thing to talk about people as people. And the whole idea of this book is to not talk about the politician, but to talk about this story, hardly of perfection, but of perseverance and struggles, triumphs, setbacks, and to do it in an honest way where I'm not sanitizing my past. I'm really scrutinizing it, and I'm trying to go multiple levels deep. And it's really been remarkable how well that's been received. Of course, critics will have a heyday about all of that and exploit it, but so what? For me, it's nice to be able to tell that story and to have that story resonate in such a deeper and meaningful way than I had ever imagined. And I say that as someone that's been to states large and small across the country, and we'll be back out for this weekend for the final leg of the tour, and it's been incredibly rewarding, to your question.
Our next question in the queue goes to Ashley Zavala with KCRA. Ashley, please unmute yourself.
Governor, I really appreciate the update today. Thank you. Both of my questions are related to Iran, though. And I don't mean to pry. I understand the sensitivity of the situation. I know you can't really share much about this potential attack threat that the FBI apparently was circulating to local police departments. But when we spoke last week and you mentioned your concerns with it, were you referring to that? I mean, that you were gaming out potential public safety concerns? I mean, is this something that you're taking very seriously? Or do you not see it as credible? And then second from that, on the oil and gas situation, you also mentioned you were gaming out worst case scenarios with that as it relates to the state and I guess it's refining capacity. Anything you can share on both of those fronts? Have you spoken to the president about any of this since?
No, I haven't talked directly to the president about this, and I wish the president would talk to the American people about what this is all about. What's the end game here? We've seen gas prices spike because of his decision, cause and effect by 69 cents here in the state of California, 60 cents plus overall on average across the United States of America. We've seen markets roiling. We've seen no real end game in sight as it relates to the Strait of Hormuz. We saw today oil prices now going back in that $90 barrel range and more concern about the extended range of the Iranian attacks, not just in the Middle East, but to your point and question about the prospects that we could see things happen here in the homeland. And so that was highlighted with Austin in relationship to your question and concerns that we had at that moment, concerns that were brought to our SOC, our State Operations Center, with our team that's assembled, which is a multi-jurisdictional team, a lot of federal agencies that are part of our State Operations Center, a lot of experts in state, but as well as local law enforcement, and it's all around intelligence collecting, and it's all about a posture of preparedness for worst case scenarios. So no, we have been gaming those out for some time. As it relates to, again, what has been highlighted, again, it's not a surprise, and it's sort of large part of the larger spectrum of considerations that we have as it relates to doing what we can to support our federal partners and local partners at the state level in terms of what could happen next. And again, the questions are in abundance at the moment about what can happen next, and I that includes, to your second point and question, if this continues, and you saw rating representatives, I hardly give them much credibility, but talking about $200 barrel for oil, you saw, and I give a little more credence to the Qatari energy ministers, talking about $150 a barrel. That's not just a shock to the pocketbook, that becomes a shock to the system more broadly. And to your point, how that games out in now more scarcity mindset, not necessarily abundance mindset. And so we're processing all those things. And you know well, we've got an outstanding team at the CEC, and we're meeting consistently with representatives in the industry, some better known than others, to sort of game out break the glass scenarios. We hope those don't occur. But I imagine there's few governors in the country that are not doing the same under these remarkable circumstances where uncertainty is the most certain component and feature of the Trump's administration at the moment and his foray now into war in the Middle East.
Our next question in the queue goes to Angela Hart with KFF News. Angela, please unmute yourself.
Good morning, Governor. Thank you for taking questions. I have a two-part question for you on this topic you've presented on today. A lot of the changes that you've described today are major structural changes that require taking on entrenched players in the healthcare system and the homelessness delivery system. And my first question is, I really want to more deeply understand, can you describe where the genesis, where the roots, so to speak, of your passion and your commitment to this issue lie? I'd like to really understand why you care so much. And I hear you today, but I've heard these stories going back a decade or more, 2 decades actually. So I'd like to understand why you care so much about these changes, especially given how difficult they are. Second part of my question is, as you know, counties in the behavioral health space and players in the homelessness delivery system argue at sometimes that there is not enough resources, ongoing annual resources to combat these issues. There are still many people in crisis in behavioral health, and there are many people still on the streets. So I'd like you to respond to that, please.
Yeah, look, let me try to do justice to both. I've never heard otherwise, going back decades and decades and decades, that there's never enough. And I'm of the humble opinion, and the more is not always better. Better is better. We have to be better. One of the key components of Proposition 1 was a requirement that we have a single plan now, not all these, multiple plans and, all the dysfunctionality that comes around finger pointing in these regions and cities versus counties, but one simple county plan. That's also a requirement under Proposition 1 with transparency and accountability. It's also a component part to start the integration, and that's what CalAIM was about. Start to integrate whole person care, something you understand intimately, others may not be as familiar with, this notion that you have to address all kinds of issues at the same time and make sure the funding streams and the regulatory thickets align with that person, not necessarily component parts of that person in silos related to it, particularly as it relates to housing, integrating substance abuse, and integrating mental health all in one. And we've been collapsing those for years and years, working with waivers, those 1115, 1332 waivers, if we did BH Connect, what we're doing on CalAIM with the federal government and CMS and all the chat. And if you're following me, I appreciate that. If you're confused, I did that even more. It's complicated. And we've been working out with this, trying our best with a new administration that seems completely disinterested in this. In fact, they're cutting programs, even though they're finding billions of dollars for this war. Cutting Medicaid, cutting Medi-Cal here in the state of California. Millions of people at risk, losing their health care, losing their behavioral health services. For what? For massive tax cuts. And yet they found billions of dollars a day. It doesn't appear to be $1 billion a day, based upon the early assessments of the cost of this war. The first few days, 5.9 billion, multiple billions a day for a war they simply cannot explain the end game for. So it frustrates, and that's why we're here in that moment of uncertainty to try to provide some certainty that the state's going to do its best to substitute or support all that is currently going on as best we can. But the biggest thing for me is this ongoing shift. And I want to thank Darrell Steinberg. I want to thank the leaders that are assembled here today and the legislature that recognize we need to provide that ongoing money, to your question, for housing components. And that's the 30% shift that's going to happen this July. And that's just about prioritization. And I know everyone wants everything for everything else, but we finally now are shifting to that fundamental priority that can really start to address some of those chronic issues and address some of those issues that are particularly happening out on the streets and sidewalks. But again, it's not just about what's happening on the streets and sidewalks. It's what's happening behind closed doors as well. And as a guy that just wrote a book about my grandfather's struggles, where he ultimately took his life, committed suicide, and his struggles as being a prisoner of war after the March in Corregidor and coming back a different man. And I exposed a lot more broadly about my own family history with parents and grandparents that I didn't even know about that were struggling across the spectrum. And I put that all out in paper. I imagine anyone that writes their family story may be able to write similar story, tragically. It's the one thing that unifies, tragically, all of us. People that are struggling, friends that have struggled with their kids at very young ages, or kids that they start to manifest as teenagers, and it just breaks your heart. A close friend of mine that I'll never forget getting a phone call, and they said, "You need to help us find him. He's at the airport, and he's been there for 2 days, and he thinks he's getting on a plane." And he was a wildly successful stockbroker. I don't want to get into the details of that, except to say, we all have these experiences, maybe more personal, maybe 1 degree of separation, that create a consciousness around this. And of course, my attachment to the issue of homelessness, going back in the early days and always trying to reform drug policy in this country that, led me to do the cannabis legalization for adults and expunge tens of thousands of records for people that couldn't get jobs because they had to sign off as a felon on those job applications. It's been a huge cause of my life. And again, forgive the long-windedness, but I'm even more long-winded in the book describing all of those things and how those knit together, and I think ultimately express the why this issue is so important to so many of us and why it must be important to the governor of California, and I pray the next administration that takes over next year.
Our second to last question goes to Marissa Kendall with Cal Matters. Marissa, please unmute yourself.
Hi, thanks for taking questions. I wanted to ask about the related program, HomeKey. HomeKey rounds 1 through 3 have housed thousands of people, but many projects have also run into problems. They haven't met their ambitious construction timelines. They've run out of funding. Construction on some has been suspended, half finished. Others, like the Shangri-La projects, have fallen victim to outright fraud. Do you feel that HomeKey has delivered on its promise? And also, what have you learned from these problems as you implement HomeKey Plus?
Well, I think they've exceeded. HomeKey's been a phenomenal success, and we've been able to numerically demonstrate that. And the HomeKey Plus, this new program, we addressed some of those time value of money questions, and again referenced in my earlier comments about Prop 1, some of those land use reforms, et cetera, that will allow us to make sure that's codified not in sort of an emergency structure or a temporary framework, but a more permanent framework. But I've got the team here, quite literally, that's responsible for the implementation of RoomKey and HomeKey, forgive me, in its new incarnation. And again, we're talking about hundreds and hundreds of projects all across the state of California that they're trying to manage and organize and operate. And I imagine each one of them brings its own opportunities and own challenges as we move forward and implement at a scale we've never implemented in state's history. Madam Secretary, Madam Director.
Sure. Thank you, Governor. I'll just add, I think we have improved and enhanced our own review processes along the way here. We are learning in each round of funding, again, what is creating a successful project, where we have seen maybe a match not come to fruition or that security of land, right? We are doubling down on our review of those processes and policies to make sure that those things are in place. We're not only looking at the cost kind of per bed, but we're also looking at it from a perspective, is it enough? Are people actually adequately budgeting for the full entirety of the project to make sure it's successful? So in each round of resources that we've deployed, and of course in partnership with Business Consumer Services Housing, we are improving our own vetting process, if you will, to ensure these projects are successful in delivering.
And I should note the math, and forgive me, I'm important to raise this, so thank you for the question. Gives me you recall that when we did the first round under Prop, it was $3.3 billion. It's about ultimately $300 million of that were projects that we went through a stress test that we were ready to lock in. But remember, we said we have to get these contracts in 90 days. The licenses have to align with the larger state vision. We had to make sure that there was real financing. So we stress test that, and about $300 million we pulled back from that first round and we redirected in this new round. It passed as prologue. We'll go through that same process and that same iterative process. And obviously now, as we tighten that process of screening and more accountability, as there's a larger maturation, we're also entering in the unknown. A lot of these are first-time awardees. So we're working with people we haven't worked with in the state. And so, this is part of that, it's just reality in a state larger than 21 state populations combined, because again, we're delivering the technical assistance, we're delivering the money. We also have these accountability dashboards, and that's important. That's why I highlighted that in the close of this presentation. And so that also is critical to also bring to bear as it relates to the utilization of these state money, and we'll continue to do that. And we have to count, we just do, on the local partners. State vision is realized locally. And I say it all the time, localism's determinative. And so we've got two remarkable local leaders here And we're only as good as they are. They've got to deliver on their promise. We all have to be held to a high level of accountability. They have to be held to light. And then they've got their own project underneath their broader county umbrella. And that, they may get 7 in a row. And then there's the 8th person, they performed in the past. They're struggling at the moment. So it's the nature of these things, not an excuse. We're tightening things up, pulling money back, more transparency, more accountability, and doing stuff, again, that just it's never been done and should have been done. But that's not a critique. It's just a fact going back decades and decades. And the best part about it, the best is yet to come in terms of those investments in the next 3-4 years. We're going to be, talk about tools in the toolkit for this state to address this issue at a scale we've never had. Those resources will save thousands of lives and create enormous opportunity to deliver real results. I'm pretty proud of that.
The final question we have in the queue that we'll have time for is Monica Madden with ABC7. Monica, please unmute yourself.
Thanks so much, Governor. Cities like San Francisco obviously have had the issue of people cycling right back onto the streets after leaving treatment. A lot of advocates say that's because there's not enough sober or transitional housing here. I know you've talked about why you vetoed sober housing proposals in the past as it relates to state funding for cities like San Francisco, but what do you think the state can do more to help on the prevention and recovery side?
Well, we've done an unprecedented amount. I've told the mayor, I've told boards of supervisors, I've told their city leadership, that's what the HAP program's about. We created flexibility. They could provide what's their top priority? What do they want to address? Where do they want to make the investments? And that's the pot of money, and it's unprecedented. Again, when I got here, that wasn't, we had a novel $500 million investment. It was one time. It was the first time in state history there was a contribution to the cities and counties, and billions of dollars later, we continue to make that investment. We're talking with the legislature right now, and they may revise if they want to go further than what we did in the January budget. But that provides support. And then there's a myriad of other areas of support that have never existed in the past, including a lot of the support we're advancing here today. And I don't know if Director or Madam Secretary, you want to amplify that further, but we were very specific as it relates to that particular bill and the precedent it would have created and the impact it would have had to the broader policies in the state. But the resources, they have been abundant by any compare and contrast. But Madam
Absolutely.
Director, Madam Secretary?
Absolutely, Governor. And I'll turn it over to the director maybe to say a little bit more. I think even within what you're seeing here in the Prop 1, Round 1 and 2 of the bond, right, we have a whole myriad of different setting types to meet the needs of individuals and communities. And of course, each local jurisdiction is identifying where their gaps are, right? They may already have a certain program type to meet a certain need in a community. And that's also where you're seeing some of the innovation of these applications in this bond of campuses, where you're actually having campuses of the different setting types to be able to meet the needs of community all in one place. So again, we have seen quite an array and span of different setting types in this opportunity, and certainly also with our partnership with Prop 1 and the Home Key Plus components. But really, this is giving some opportunity and flexibility for locals to address the gaps in their own community. Director, anything else you'd add to that?
Sure, I would just add, as part of that integrated planning that was referenced earlier, really thinking about the continuum of behavioral health services and housing services, and thinking about that 30% in housing intervention, how those dollars can be used for sober living and recovery homes, how the new Medi-Cal managed care transitional rent benefit for our individuals with behavioral health needs, also how those dollars can be leveraged and kind of pieced together to provide ongoing services for individuals needing a roof over their head to recover and to transition into permanent settings.
Yeah, and thank you for bringing up the transitional support. I mean, again, this stuff never existed a few years ago. I really, look, I want to see results. I want to see results. You want to see results. We all want to see results. We deserve results. And this state is stepped up. And you saw that list on the transformation. There's 20 things there. And so mindset has to shift here. We're stuck in a lot of the old talking points. I get that. And everyone wants more and more and more. It's time to look inward, fundamentally reform, and to fundamentally focus on delivering results in real time, accountability, be more transparent as much as we can be in terms of the struggles and the stresses. And again, I'll close on this. We also need to be flexible. And that's the spirit of Care Court, and I appreciate that first question, and a desire constantly just to address whatever the unique issues are in unique parts of the state that are conditioned with unique assets and unique burdens, and to make sure that we're not designing something that's one size fits all, that provides an ample level of flexibility that people deserve. So appreciate everybody for being here. Thank you for opportunity to highlight and update this citizen-driven initiative to the people of the state of California. I should have opened up with this. Thank you for doing something few have ever been willing to try. You guys stepped up. The people of the state stepped up. And I couldn't be more proud of the progress that we are promoting and the results that we've already delivered. But again, the next few years, you ain't seen nothing yet. And so thank you all very, very much.